Hi, I'm Wesley Thornton. I'm here with Corey today, and we're performing an Astran submaximal cycle test. I'm just going to get Corey started off on a little warm-up, and I'll explain to you more about the test and about Corey specifically. So Corey, how you doing today?
Pretty good.
Great. We're just going to get you started off on a little warm-up.
Okay.
You hear that metronome going. I want you to try to keep that rhythm, all right?
Okay.
About 50 revolutions per minute you'll be doing.
Okay.
It is zero workload, so I'm going to start that clock, 2-minute warm-up. Keep that pace up. Let me know if anything feels out of the ordinary, okay? So the reason we're doing this test is to assess Corey's maximal aerobic capacity, or his VO2 max, and we're hoping to find that out during this test. I feel comfortable starting Corey off on this test because talking to him about his exercise history and his lifestyle, I've concluded that he's at a low risk factor for cardiovascular disease, 0 risk factors in fact, and he is an active person. He's conditioned, which will play into the workload I use for the actual test. So after those conclusions and coming to those conclusions, I've decided that there's no medical clearance needed for him to perform this test, no medical supervision needed while he performs this test, and there should be nothing we see abnormal in his vital signs, his heart rate or blood pressure, during the course of this test. So I feel very comfortable going ahead, and that's what we're going to do. I'm obviously going to keep check of his vital signs every few minutes, keep in check with how he's feeling physically, and hopefully come to some sort of conclusion about his aerobic capacity and how I can continue to prescribe exercise for Corey in the future. As you see, as he's riding the bike, I've set up the seat with the height of his greater trochanter just to ensure optimal riding position, right amount of knee flexion, and just an optimal safe riding position throughout the course of this test. So I'm going to check in with Corey in a few seconds. I'm going to take him up to a workload of 100 watts, which is predetermined by his exercise activity and his gender. And then we're going to get into the test, keep track of his vital signs, and I'll explain more as we go along. Still feeling okay? Great. In about 10 seconds here, going to keep up that same pace. I'm just going to increase that workload to that 100 watts I talked about. 2 kilopons on this bike here.
Okay.
We're going to get into that test. You all set?
Good.
Great.
Do it.
Good. Feel a little more effort put into it. Great. So you let me know if anything feels out of the ordinary, any dizziness. You're trying to keep that pace up. We're going to check those vital signs at about 3 minutes from now. All right, and see how you're progressing. See how you're feeling. Great. So in order to perform this test, we need to get Corey into what we call a submax range, between about 60 to 85% of his maximal heart rate for his age. And for Corey, that specifically is between 113 to 161 beats per minute. And in order for me to really assess his maximal aerobic capacity, or his VO2 max, I'm going to need to get Corey into that range for this test. So we're going to let him take this test. It should be about a 6-minute test. At about the 5-minute mark, I'm hoping that Corey's system has gotten used to this workload and that for 2 consecutive minutes, I get a steady heart rate. A heart rate, between 3 or 4 beats of each other. I'll then know that he's in that steady state, and I'll use that heart rate to determine his VO2 max for this test, and then ultimately his prediction for his maximal VO2. And then I'll be able to prescribe exercise effectively from there. Like I said, Corey has no risk factors, and the only reason I'd ever stop this test is if his heart rate got above that 85% of his target heart rate, if other abnormalities with his blood pressure happened, for example, a systolic above 250, a diastolic dropping or a heart rate dropping as the workload increased. I don't expect to see any of that with Corey, but I'm going to keep an eye on it, and if that happens, I'll stop the test. But I expect a smooth test with vital signs rising as he gets used to this workload, and then eventually evening out or steadying out. Still feeling comfortable? Great. Good, good, good. So we have about another minute left. Feeling okay? Good. So what we're going to do is we're going to take this now, and then in 2 more minutes from the moment I start taking it, we're going to take those vital signs again. All right. Actually, let's start with that heart rate first. So you go ahead and like this. This. Now take your hand, just rest in line. Good, let that hand rest there. 29, so you're 116 beats per minute in that submax range. Relax that hand down. Slip those between these fingers again. Thank you, sir. So I got you at 135 over 60. 116. And how are you feeling looking at that RPE scale?
12.
About a 12. So Corey's rate of perceived exertion is about a 12, which is kind of fairly light. Great. So in about another 10 seconds, I'm going to take these vital signs again and kind of see where Corey is. Perfect. I'll take this from you. Just relax that hand. There. Good. So I got you at 128. Thank you, sir. Relax that hand down. 137 over 60. And taking a look at that chart again, that RPE,
13.
13? Great. Alrighty, it's about that time. I'm going to check just that heart rate again and see where you're at. Give me that hand. We can let this hand to the side. Relax that hand. Perfection. All right. Got you in that steady state again at 128 beats per minute. So I'm just going to write that down. Perfect. So now you're in that steady state, 2 consecutive minutes. So I'm going to start to turn you back down to a 0 workload. I'm going to give you a 2 to 3 minute cool down. After that, we're going to check those vital signs, make sure they're responding normally. Plug those into an equation and talk about your VO2 max and prescribing some exercise for you.
Ready.
Great.